I'm Dr. Roosevelt Gilliam. I'm at the University of North Carolina at Chapel Hill. I'm a cardiac electrophysiologist, which is a type of cardiology that deals with electrical abnormalities of the heart. What happens in atrial fibrillation is that the heart doesn't squeeze very regularly. And so blood flow through the heart isn't smooth, and there are parts of the heart, particularly the left atrium, where there may be pooling of blood, which allows blood clots to form. These small blood clots can suddenly break off. They go into circulation, and the first thing it goes is straight up and go right up into your brain, and that's when you can have a stroke. If you have atrial fibrillation, you need to take care of things like thyroid disease and high blood pressure. If you have heart failure, certainly you need to control all those things, because all of those factors increase your risk of stroke. It's bad to have diabetes. It's bad to have atrial fibrillation, but it's real bad to have both, because the problem doesn't just go 1 + 1 is 2. Sometimes 1 + 1 gives you 6, and then +1 gives you 15. Once you get atrial fibrillation, once you have hypertension, once you have diabetes, you need to have a very close relationship with your primary doctor. I'm the cardiologist. I may only treat the heart, but I have to be aware that the heart doesn't exist in a vacuum. And so we have to communicate with our colleagues who are primary care physicians. We have to talk with the neurologist. We have to talk with diabetologists, people who treat hypertension. All these have to be coordinated so that patients can be treated successfully for all of these problems. The hardest thing that I think is to be ever vigilant about a problem that's silent and sneaky. If you treat someone for 10 years with an anticoagulant, nothing happens. Let's say they no longer have atrial fibrillation that we've seen in a year or two. So the thought then is, maybe I don't need to take the medicine anymore. Maybe my risk is past. Even though they may not feel a thing, this is a significant problem. If we know that there's only a 10% chance of stroke in a year, well, we can say there's 90% chance that the patient is not going to have a stroke. But if you're the 10% that ends up with a stroke, it's 100% for you. Prevention is the whole ball game here, because once you have a stroke, you can't undo it. A person who's able to walk, talk, drive themselves to work, do a number of things, even if they're just going down to the mall, that becomes forever lost in many instances when they have a stroke. So even though they may have risk of falls, risk of bleeding a little, those risks are much, much less than typically the risk of taking an anticoagulation to prevent strokes. Strokes are really a severe problem that we have, not just the immediate time they have the stroke, but for the life of the patient. Their life will be forever changed. A year without stroke is a year that you could enjoy being with your grandkids. It's a year that you can enjoy doing the things that you've worked all your life to finally get to do. You took care of yourself. You did what is necessary for you to be around one more year. And then next year, we'll celebrate one more year without a stroke.